got all our mics on? I am green. Okay, the light's working. Thank you. Alrighty, before we bring the meeting to order, we'll start with the Pledge of Allegiance and just a quick moment of silence for the one gentleman that passed away. If you could join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. If we could, just a moment for our citizen who passed away from complications and any others who may be afflicted in the county. Thank you. Okay, it's 9:01 on April 1st. Elbert County Board of Commissioners meeting as the Elbert County Board of Health. Amanda, could you call the roll, please?
Commissioner Richardson?
Here.
Commissioner Thayer?
Here.
Commissioner Pettit?
Here.
Alrighty. We got a one-item agenda before us, discussion of the current COVID-19 situation and actions being taken in Elbert County. Accept a motion to approve the agenda as presented.
Mr. Chairman, I move that we approve the agenda as presented.
I'll second.
Okay. Motion and a second. All in favor, please say aye.
Aye.
Aye. Motion carries. Alrighty. Yeah. So, with that, Dwayne, I know we're streaming on Facebook, our YouTube Live today, so for folks that have not met our Public Health Director or have only seen him from behind as he briefed from the podium, Dwayne, if you could just, the camera's up in there, just so if you wanted to give a wave so folks know who you are. But with that, I'd turn it over to you for just to kind of take us through the update, and we'll have some discussion afterwards. So, thanks.
Thank you, Mr. Commissioner. Good morning, commissioners, staff, Elbert County citizens. As you know, COVID-19 or coronavirus is a respiratory disease that's most commonly spread through respiratory droplets from a cough or a sneeze. While we're still learning exactly how it is spread, it is highly contagious and very commonly spread through close contact between people. The most common symptoms of COVID-19 mimic that of the seasonal flu and are fever, tiredness, and dry cough. But please make no mistake, this is not a seasonal flu. This disease can be serious and even fatal, particularly for older adults and those with underlying health conditions, causing pneumonia and respiratory failure. I want to acknowledge that these are confusing, anxiety-filled, and uncertain times for all of us. We're faced with an incredibly powerful and new phenomenon that's affecting the entire globe. Within a matter of months, the virus has traveled from a small region in China to our community here in Elbert County. Because we haven't seen this virus before, we don't have any immunity to it, and that's why you may have seen it labeled as a novel coronavirus. The virus has several unique properties besides the fact that it spread human to human. It binds to certain cells in the body, one of which is the air sac in the lungs. The virus enters the cell and starts to reproduce inside the lung. The body's response to the virus is to try to create inflammation to fight it, which in some people creates a severe inflammation that causes injury to the lungs. In some patients, the injury is mild, causing a cough and mild shortness of breath. In others, it causes such severe inflammation to the lungs that the lungs fill up with fluid and mucus where oxygen can no longer get to the bloodstream and patients can no longer breathe on their own, which necessitates the use of a mechanical ventilator to assist patients with breathing. This is why there's a nationwide scramble among hospitals nursing homes, assisted living facilities to obtain the ventilators. In yesterday's CDPHE press conference, it was noted that in a worst-case scenario, or at the peak of this epidemic, Colorado will need approximately 5,000 ICU beds and 7,000 ventilators. For perspective, the entire state currently has an inventory of 1,849 ICU beds. People are contagious very early on in the infection, potentially before they're even symptomatic. A recent study conducted by researchers in Germany found that 9 people infected with the novel coronavirus were shedding huge amounts of virus. And when I say shedding the virus, I mean they are contagious and passing that virus on in their immediate surrounding. If you've probably heard the 6-foot distancing, that is where that recommendation comes from. If you're within 6 feet and close to someone that is shedding the virus or emitting the virus, your chances of becoming infected are much greater. When people shed the virus, they're shedding thousands to millions of copies of the virus as early as day 1 of their infection, when they only had mild cold-like symptoms. In fact, the virus levels in the nose and throat were highest on the first day and declined in the days after. This suggests that infected people are shedding the virus even before they are symptomatic. This is one of the main points for the social distancing and the stay-at-home orders. Someone may feel well, may not have a fever, or may have a very low fever, yet still be highly, highly contagious. It can take up to 11 days for the symptoms to appear after infection. Research has shown that the median incubation period is 5 days. That means some people will develop symptoms sooner, and some will develop them later. The study also reported that only 2.5% of people showed symptoms 2 days after exposure, and 97.5% of people were symptomatic after 11 days. This means that if you've come in contact with someone who has the virus, you need to quarantine for the full 14 days to be safe. This time frame is especially important because you can be highly contagious during this time and not even know it. We get a lot of questions about how long can the virus live outside of the body on various surfaces. The virus lives on surfaces for up to 3 days. In one experiment, scientists created an aerosol that contained the novel coronavirus to mimic how it would be sprayed by a sneeze, a cough, or someone exhaling. Then they sprayed the aerosol onto different surfaces to see how long the virus could survive. On copper, the virus was detectable for up to 4 hours. On cardboard, for up to 24 hours. And on plastics and stainless steel, for 2 to 3 days. This means that objects can remain contaminated for a much longer time, and people can become infected with the virus if they touch the object and then touch their face. You can also get infected if you inhale a sick person's sneeze, cough, or their exhale. I also want to share that this information doesn't mean that anyone should panic, but you do need to take the pandemic seriously. Everyone has a responsibility not only to protect themselves, but to protect their friends, family, neighbors, the Elbert County community, the state at large, and our nation on a larger scale. You don't want to be a vector for the virus, and the best way to curb the outbreak is to strictly practice social distancing. Again, this means adhering to the stay-at-home orders. I'll talk a little bit more about the current state of the virus in Elbert County. When I wrote these slides. We knew they would be a bit dated by the time we got to our presentation here. We have several confirmed cases, including one death. As of this morning, there were no new cases reported. We believe we have 6 confirmed cases. What's important to note and to understand is that the confirmed cases only represent those individuals that received a test, and the test was either sent to a state lab or a private lab. As you've most likely heard in media reports, there have been challenges with testing from the start. What is not reflected in the daily numbers that are reported by CDPHE are those folks that are likely contagious, that have an active infection, that have not been tested. Those numbers of folks, the numbers are exponentially higher. Someone can have the virus, as I said, and not even know it, and be passing it on to someone else and not even know it. The state is working on a partnership with Google and Google engineers to develop a surveillance platform where they can track not only, obviously, the cases that have been tested, but also folks that are experiencing symptoms, and get a better, more accurate handle on the magnitude of the exposures around the state and by county. One of the challenges we have in Elbert County is that our health department, Elbert County Public Health, has no test kits, nor do we have capacity to test. In other words, we don't have a nurse, we don't have anyone trained to administer the test. In the entirety of Elbert County, I am only aware that one entity, Peak Vista in Kiowa, our federally qualified health center, a couple weeks ago was provided with 5 testing kits. Those testing kits were reserved for existing Peak Vista clients. I have not checked with them to see if they had all been administered or whether their testing is exhausted. So folks that have orders for testing will need to go outside the county to get tested. Here's another challenge with the testing. As this epidemic has evolved, let me back up. In a normal approach from a public health perspective, we would do massive amounts of testing, and then the next phase would be the social isolation of those folks that are testing positive for the virus, and then we would do contact tracing. For example, someone that tested positive, we'd interview them over the phone and ask questions like, have you been to any public events? Who have you been in contact with? Have you been to school? Have you been to work, et cetera, et cetera? And then we would monitor those other environments. Unfortunately, we are way past that point at this juncture. And the advice that we've been provided, the guidance that we've been provided is rather than worry about testing, if citizens are experiencing symptoms of the virus, they should assume that they are infected with the virus and isolate in their home accordingly. If you do have symptoms of the virus, believe you have the virus, certainly contact your primary care provider, hopefully you have one, and ask them for guidance. They are most likely not going to test you or administer a test, again, because of the dearth of tests, not only in Elbert County, in Colorado, but nationwide. If your symptoms worsen, call your provider. They may advise you, depending on the severity of your symptoms, to call 911. Testing kits are currently being prioritized for first responders, in other words, law enforcement, fire rescue, EMS personnel, and also healthcare personnel that are providing acute care for not only those folks that are infected, but everybody else that would be in a healthcare environment for any other condition on a normal day. The reason for that is we are at a point where we need to preserve the healthcare safety net. In other words, if we don't protect those that are administering life-saving support and services to those infected, we're going to be in a whole nother world of trouble. Another common question we get is, how many Elbert County residents have been tested? We do not know. Again, the Google platform hopefully will begin to provide some evidence of that. Many of our folks, as residents are aware, work outside the county. And the numbers and rates of infection outside our county are significantly higher. Of everyone that's been tested in Colorado, and as of this morning's report, last night's report from CDPHE, 16,849 people have been tested. That's an increase of 1,485 over the previous day. Of those 16,849 tested, 2,966 have tested positive. When I did this calculation on Monday when I was doing the slide decks, that translated to approximately 16% of folks that are tested have come back positive for the test. To share some additional information, 509 individuals have been hospitalized. 50 of the 64 Colorado counties have an active case of the virus. That continues to grow day by day. Sadly, we've had 69 deaths since the inception of the virus in Colorado, and we've had 16, possibly 17 outbreaks at residential and non-hospital healthcare facilities across the state. We're unaware of any of those. To the best of our knowledge, none of those facilities are in Elbert County. You may have heard in media reports in the last day or so, we are entering, over the course of the next 2 weeks, a very rapid acceleration of the numbers of cases that we'll see across the nation. This is a critical time. I can't emphasize that strongly enough. This is a critical time for folks to adhere to the governor's executive orders and the stay-at-home orders. We get a lot of questions on things like, can I play golf? Can I play tennis at the tennis courts in our homeowners association or other areas? Ladies and gentlemen, that's just not a good idea. And I would strongly urge you to forego that. Certainly, folks need to get outside and exercise. There are other mediums to exercise that don't involve putting your neighbors, citizens of the county, at increased risk, particularly those that are elderly and vulnerable or immunocompromised. Please adhere to those the guidance and the message and the various executive orders. So what has our response efforts in Elbert County look like? First thing we do in the morning, the health department, our environmental health specialist, Stacy Reinhardt, she checks the Colorado Electronic Disease Reporting System. That is the statewide database. Historically, we've used that for things like influenza cases and hepatitis and things like that. Now the priority is the surveillance for the COVID-19. I report that out daily in updates to elected officials, school superintendents, other key county and community personnel. We have a daily huddle with our Elbert County leadership team, where we look at what's happened in the past day and look to the extent possible prospectively to what may be coming down the pipeline on the day of. Again, as I mentioned, there's a daily email with a status report, a situation report, as well as other guiding documents, not only from the state health department, CDPHE, and also Tri-County Health Department, who we rely heavily on for emergency management, surveillance, and a variety of other public health functions. We receive daily communication updates from CDPHE, Tri-County Health Department, and the Colorado Association of Local Public Health Officials. It's not uncommon for myself and others on the leadership team to be in as many as 4 or 5 conference calls or updates each day. Through our Office of Emergency Management and Alex Jabakowski, we have a weekly conference call with our emergency management partners. For those folks that are infected and we have received notification through the electronic disease reporting system, we do a CDC case report for those confirmed cases. In that case report, and if anyone would like to see this, simply Google CDC case report for COVID-19 or coronavirus, and it's readily available. We ask about symptoms and date of onset of symptoms and a variety of other things, including have they been to any community events where they might have potentially spread the virus. That is our ability to find actionable data on that is somewhat limited, again, because experts believe as many as 25% of the population now may be infected. That is nationally. Again, some folks will have very mild symptoms, some folks will have severe symptoms. And we hope you're looking at the social media platforms where we are messaging updates and protective factors via Elbert County Facebook and Twitter. I would encourage folks, if they have questions, to call a reliable source like the health department and do their best to tamp down rumor and innuendo. That can be incredibly toxic and also disheartening to our efforts. We'd rather spend our time aggressively working towards mitigating transmission of the virus than responding to unfounded rumors.
If we could just for a moment, let's trade out mics. Yours is turned red. I just want to make sure it's still transmitting. Yeah, Thanks. I want to touch on a little bit about an approach we use in public health that's very informally we refer to as layers of protection. And layers of protection are needed to mitigate the community transmission of the virus. Those layers are at the individual level, the relationship level, a community level, and a societal level. At the individual level, hopefully everyone has heard multiple times the need to wash your hands, to cover a cough or sneeze with a tissue, to avoid touching your face. And I would also add to that, regularly, multiple times a day, cleaning your phone and other electronic devices. If the virus ends up on your phone and that phone is on your face, you're going to transmit the virus to yourself. At the relationship level, avoiding close contact with family and peers and people in your social network. At a community level, we've implemented social distancing policies at the statewide level.
We've closed schools, school districts, gyms, restaurants, bars, and many other locations where folks typically congregate, and there are environments that are ripe for transmission. At the societal level, we, over the last several weeks, have been changing the social and cultural norms through issuance of stay-at-home orders. A frequent question we get is, how long is this thing going to last? And that is really the $64,000 question. No one knows. This process is still evolving, but I would encourage folks strongly to prepare for the strong possibility that this epidemic will last into early summer, meaning early June. So do what you need to do within reason, without panicking, to prepare yourselves both and your family, physically, mentally, for a protracted approach to combating this virus. Some lessons we've learned thus far, and again, we've really been trying to address this and tackle it for the better part of March, at least the last 3 weeks, maybe closer to 4 weeks. We've yet to experience that rapid onset of cases, in other words, that tidal wave. You've no doubt heard the media and others using the term flattening the curve. That flattening has yet to occur. We are fighting against something that is very unknown. So that's why it takes every person, every citizen to do their part. As a result of the epidemic, our county resources will continue to experience challenges in nearly every department. Sorry, excuse me there. As I stated, the epidemic may potentially last until early summer or beyond. I encourage the commissioners and the rest of county leadership to develop a plan to address the protracted disruption of typical government functions. Again, these are confusing times, uncertain times for all of us. Please, everyone, closely monitor your physical and mental well-being. This can be incredibly taxing to even the most well-adjusted citizens, both physically and mentally. Those who have behavioral health conditions, it most likely has exacerbated those conditions. So regular communication with your healthcare provider, which can include nurse call lines from your insurance carrier or from the state. Please take advantage of those resources. I want to acknowledge that the county response has been a team effort. I'm very proud to have been a part of this team. The tremendous efforts from our local response team, including Sam Albrecht, Eileen Krauth, Alex Jabakowski, and Commissioner Richardson, as well as all the other county employees that have stepped in to fill the void created when our response to the epidemic has drawn them away from their normal job duties and responsibilities. Rest assured that we are doing all that we can to protect the citizens and residents and visitors to Elbert County. But again, we can use all the help that we can get from citizens to do their part. I will pause there, be happy to entertain any questions that anyone may have.
Yeah, I was going to say, obviously been sitting in on the daily meetings with you. I'd turn it over to Grant and Rick at this point if they've got specific questions. I've got a few points I'd like to to make afterwards, and a few questions just for you to clarify, I think, for,
Mine is a curiosity question, is that you said that there's been 6 confirmed cases. And if I remember right, the first 3 were in a single household, about 2 weeks ago? Do we know of any of these people being recovered?
So yesterday I did, we were able to identify 2 phone numbers for that household. I did reach out to them, was not able to get a hold of them. To the best of our knowledge, they're doing okay. We've not been notified through any emergency means that they have had any worsening of the cases. Some folks may not want to be contacted in these instances. So, yeah, at this time, it's likely that the virus has run its course. And we hope that those family members are on their way to feeling better and resuming as typical daily activities as will be permitted under executive order and social norms.
I don't have anything right now.
yeah, just a few of the points that you touched on earlier, kind of, if you could expand or just, one that you had mentioned, the Google surveillance platform. I mean, surveillance has a very different meaning in the public health world than in the general use, so that we aren't going to have Google drones flying over people's homes.
Yeah, thank
It's
you
a
for-
data entry and analysis tool, is my understanding.
Yes, thank you for clarifying that. That's very important, clarification. We are not spying on anybody, nor is Google. Surveillance from a public health perspective means studying the distribution and determinants of the disease. In other words, well, let me give kind of an example. You folks may have heard about cruise ships, cruise lines, where a large proportion of the passengers were exposed to the virus. Those passengers, before they were allowed to disembark from the cruise ship, surveillance measures were set up. In other words, their symptoms were monitored while they were confined to the cruise ship. Information was gleaned, where's your home state, where's your home community, here are the things you need to look out for, you need to isolate, et cetera, et cetera. That's how we can, to the extent possible, anticipate where the virus is moving. Early on in this epidemic, when we would do case reports, we would ask questions like, of the infected individual, have you been to China? Have you been to these other hotspots around the world? Have you come in contact with anyone that has tested positive for the virus? That has subsequently been informally updated to ask questions like, have you been to New York City? Have you been in contact with anyone that's been to New York City? Over the weekend, there was one estimate that I saw that 60% of the cases in the United States were thought to be somehow related to someone who had either been through New York or was from New York City. So again, this approach and the disease itself evolves day to day, sometimes a couple times a day. It's fair to say almost hour to hour.
Okay.
So yeah, folks, please be rest assured that the surveillance does not mean that your individual liberties guaranteed under the Constitution are being compromised.
I appreciate that. The other, really didn't touch on it, but we do have a relationship with Tri-County Health in terms of support services from them, though we operate under our own Board of Health here. If you could talk a little bit about what Tri-County does for us and how that works.
Yeah, so, good question. Tri-County is a very large support for our emergency management in all its forms, including communicable disease outbreaks. Our initial 3 cases in the county were erroneously, inadvertently assigned to the Tri-County footprint when we realized they were within the Elbert County geographic borders. They did the initial contact investigation and case report for us. They support us in a variety of ways. They are one of the daily situation update reports that I receive with more specific information on cases from Adams, Arapahoe, and Douglas. And as a large portion or significant portion of our population works in one of those 3 counties, you know, the virus doesn't stop at the county line. It's transmitted freely back and forth as folks may be exposed in other areas. And I can say without revealing any protected health information that at least in a couple cases, the virus has, based on our best guess, and that's all it is a guess, because no one knows for sure where the infected individuals acquired the virus, that it came from outside our county.
All right, thanks. Anything else, or? I've got-
Yep, yesterday, the president was talking about the next 2 weeks could be significant and stuff. Do they have any kind of projections on what's gonna happen, like in the metro area for Colorado? You know, if they're looking at an explosion, or are they, thinking that maybe the curve is flattening in Colorado?
I don't believe the curve is anywhere near flattening in Colorado. We have in Colorado some great analytical minds at the University of Colorado and at CDPHE that are developing models to predict as best they can the impact in terms of the volume and rates to the state. Again, I believe we're still on the uptick, the upswing of that curve, or that wave, if you will. A couple of the key analytics that state and local leaders will be looking at is not so much predicated on the number of infections or the number of fatalities, but rather the number of hospitalizations. So of those infected, how many are so severe that they necessitate acute care to resolve the condition? And another of the key indicators are the number of acute care procedures that are done to address the symptoms for those folks that are hospitalized. In other words, how many people are on ventilators? How many ventilator days, how many days are they on ventilators will be tracked. That's all part of the Google platform that they're working on. That is a work in progress with the Google engineers and the state data folks. We just got notification of that, I believe, on Monday afternoon. They are, I believe, optimistically hoping that it will come out in, hate to put timelines on things because they so often aren't met, but hopefully in the next week or two, we'll at least have some preliminary dashboards to look at so that we can more accurately track the course of the virus.
Yeah. Thank you for that. So my next question actually was going to be that, do you see the state providing different types of information or different levels of usefulness? I mean, 509 hospitalized, over the last month, I'd assume the majority of those are no longer in the hospital, so, you know, and I think you got to that is looking at actually how many beds currently are available, how many ventilators currently available, not just, the rolling totals are interesting over time, but don't tell you what day-to-day is.
I would say,
Is available.
with regard to the folks and the number hospitalized, it's important to note that I believe the average number of days someone would spend on a ventilator is 8. However, that's an average. Some folks may be 14, 16, 18. Some folks may be less, depending on whether they had a pre-existing condition or were in optimal health. So,
Yeah, I was gonna say, just our morning meetings, I know that's always kind of a, what does the data mean? Some seems disconnected. I mean, I think the, you know, prudence, not panic, that you talked about earlier is very important, but even when we're looking at, you know, 14,000 plus tested, about a 16% positive rate, folks aren't being tested unless they're really showing a lot of symptoms, but we believe 25% are infected, so a lot of that's asymptomatic.
right, a lot of folks are not
I know
exhibiting
it's a very
symptoms.
just frustrating,
Yeah,
it's frustrating from our side, I know, because
Yeah.
we're hired to help act and protect, and
yeah, and if
I
I
know you're in
can,
that same boat of not really, the data doesn't really clearly show, it's wave tops, tip of the iceberg type stuff, so.
Yeah, being an engineer, I like to analyze curves. And I understand the peak curve, and you're trying to flatten it out. But my question is, when it's all said and done, will the same percentage of the population be infected? It's just spread over a longer period of time?
yeah, so flattening the curve basically means we're trying to spread out, as you said, the number of folks infected. We don't want a large number or the preponderance of infections to occur in a compressed or compacted period of time where hospitals and providers are overwhelmed. One of the ongoing challenges from the beginning of this has been the dearth of personal protective equipment, or PPEs. One of the barriers to testing more folks, not only in Colorado but nationwide, is the test that is done to gather the tissue sample is a nasopharyngeal test. In other words, a swab is inserted into the nasal cavity down the throat in a very uncomfortable fashion. If folks have ever had that done for any test, you know what I'm talking about. When that happens, most folks will either have a gag reflex, a cough, a sneeze, or something like that, where they are expelling and aerosolizing this virus, if they have the virus in them. So the person doing the testing has to have a gown, a face mask, gloves, a respirator, an N95 respirator, personal protective equipment, so that, again, our healthcare workers aren't becoming infected trying to do their job. One of my fears that I believe is shared by most, and folks have most likely heard how healthcare providers are forced out of necessity to reuse respirators and other personal protective equipment. In a normal environment, in a typical daily hospital operation, that would never happen. Infection control is paramount. And if any provider were to do that or be observed doing that, they would probably be terminated for not adhering to normal policy and procedure regarding infection control. Multiply that by every healthcare worker who's in that difficult situation. across Colorado, across the nation. And you kind of get a better sense of how precarious the situation is in acute care facilities, and the need to protect, again, with the testing kits, reserving the testing kits for those folks, and initially when there was some relief for childcare for those workers. That has since been expanded to some other essential folks. So, yeah, getting back to the initial question of flattening the curve, our infrastructure, our acute care infrastructure is better able to handle this if we can take it in smaller bites. If emergency departments are flooded and hospitals and other acute care facilities are flooded all at once, there simply aren't enough healthcare personnel. And that goes beyond the doctors and the nurses and the technicians. That reverberates to the lab techs that are conducting the tests on the tissue samples. There are so many disciplines that go into providing care for one person, so many departments, so many different areas of personnel, right on down to security personnel. So the potential exists that folks may be overwhelmed, acute care facilities and hospitals may be overwhelmed if we don't all play our part.
Thanks. We've got a few other folks in the room that may be off camera. Dallas, clerk and recorder, did you have any questions or comments for your folks?
I sure appreciate the presentation this morning, Dwayne, and all your efforts and the team in working on this. My question goes more to specific operations. In elections, we are always preparing for the worst, whether it's an electrical outage or a tornado or a fire or a flood or whatever. And so we have daily contact with the Secretary of State's office and our clerks association with the upcoming elections. So specifically, my question is, if in the unlikely event that someone within our office were to test positive, what would be the procedure for the building? Would the building be shut down for a period of time, or would it just be those folks that had had direct contact be expected to do the 14-day quarantine? So I'm looking for some specifics so that as we make our plans going forward, we can do it properly.
Sure, good question and a relevant question for not only your office, but employers in general. So if someone has had contact with an infected person, there's a strong possibility that the virus will be or has been transferred to them. And again, their symptoms may be non-existent, they may be mild, they may be severe. We need them to quarantine for 14 days in their home. As far as shutting down the rest of the building, I'm going to defer to Sam or Chris or someone else at the county level to weigh in on that.
We're working up those protocols right now with Dwayne's input on how we're going to handle that if somebody within a single building becomes infected. It's going to kind of be an interview process, I think, with the staff there to see how close a contact they were, if the person was coughing and sneezing and spreading virus, and how long the symptoms were there. But it's going to be, right now, I don't think, Dallas, that we have an answer for that question.
Yeah, I was going to say, I certainly don't pretend to have expertise in virology, but I know the school districts had put some pretty strong plans in place very early on. If a elementary child was sick in a classroom, it wasn't one that traveled through the building like in a high school where people are all over the place. They had a certain number of days the building would be shut down, sanitation processes that would take place. I think in our case, I know we've really set your building to be the election headquarters, but if on the IT side, those pieces, if we could jump to a fairgrounds building or something, that's probably, if we can't shut down for 3 days right on election day and hold an election. So I think there's probably got to be some some looking at when do we jump to a different facility, and likely it would be one of our fairgrounds ones, just as those are empty generally already, and we're not displacing others or having to worry about jumping into another building that make our plan to jump into this building when we've had people infected in this 2 days before that. So this one's then not available. It's probably better to make that jump to the cleanest, least used building, and that's kind of my thought at the moment. So,
And we already have contacts throughout the county for different locations. If for some reason, because the tile is all electric
Yeah.
down, we have to be able to move to a different location. So we can certainly be flexible, but if we have kind of an idea of the direction that we're heading before we get there, we can certainly prepare better
Yeah.
than making a decision on the fly. And so that's the only thing that I'm looking for is
Yeah.
direction beforehand so that we can have all those possibilities.
yeah, and I think I'd ask probably sometime over the next week or so, if it's reasonable to say there's a time period we would shut the building and what would need to be done to sanitize before we reopened. We probably ought to know what that closure window would have to be. And if it's 3 days or 7 days or 14, it's going to make an impact depending on where we are in the election process, clearly, so.
And if Dwayne's right, we're still looking at through the end of the first half of June, most of our election judges are over, would be more of the at-risk population. We have ballots that start coming in by the middle of June, and so we just have to know what we're up against. It's not just a one-day event for us anymore, it's several weeks, so, that's just my questions, and I know everybody will work on it, I'm just
Yeah.
trying to get a head start on it.
Yeah, I'm kind of curious. I mean, you had mentioned how long the virus could last on cardboard. And across the state, it's all mail-in, all drop-off paper. So I don't know if that'll be at the state level, some guidance on, do we need to sanitize envelopes as they come in? Do we need to sanitize the privacy sleeves as they come out, and then the ballot itself? Or are we going to try to feed wet Lysol soaked ballots into the scanners? Or, I mean, there could be lots of issues. I'm glad I'm not the county clerk.
But that does bring up an interesting question. You're watching on TV, you see these guys walking down the streets with these sprayers and things like that. If they do have such a situation, and we brought in a professional to sanitize it, are we talking about days, weeks?
I can look into that and get back to everyone with an answer.
And are these people actually available?
Yeah, that's probably a more valuable question. I would anticipate a run on those types of services.
I mean, and then I guess within the county, I mean, Road and Bridge has folks that are trained for weed spraying and all the protocols that go along with handling those chemicals. That might be something similar. We may have some folks that we could repurpose, retrain a little if we had the material we needed to sanitize.
If I can segue, Dallas's question jogged my memory about the court system, the judicial system, and folks getting called for jury duty. And I understand a lot of the processes have ground to a halt, and perhaps Bart can speak more to that. But if elderly residents have been called for jury duty, we have met with the clerk of courts, and she is amenable to excusing folks from jury duty. Obviously, if they have any immunocompromising situations, healthcare conditions, if they are, for example, currently undergoing treatment for cancer or any other life-threatening condition, if they are over 60 and you get a summons to appear for jury duty, our clerk of courts is amenable to excusing you in those highly at-risk populations. So please keep that in mind if you are called for duty, and I would say prospectively for the next couple months.
Yeah. And I hope they extend that to first responders and medical professionals that.
Yes, agreed.
Okay. Do you have anything else? Or-
No, just no.
Sam, anything, or? Okay, yeah, with that, I guess we'll get ready to close the meeting. I was just looking, we've had about 25 folks that were watching this online. I hope you found it useful. Dwayne, Alex is in here, Sam, for the rest of the staff, just been a tremendous effort over the last couple of weeks. Our local citizens helping neighbors, local citizens groups, nonprofits, our first responders, the town leadership, food banks, you know, everybody's leaning in, trying to do the right thing and help their neighbor, and that's kind of always been a given in Elbert County, and it's good to see it happening even over a different type of crisis in a more extended period of time. But for folks that are watching online, if you have specific questions, if you're looking for information, I do encourage you to come to the county Facebook pages, the county website, you know, come right to the horse's mouth. We'll be happy to try to get out as much information, as accurate as we can, while still protecting the privacy of anybody that may be ill. They're trying times, but I think we'll all get through this together, and you know, it'll be in the rearview mirror at some point. So thank you, everybody that attended remotely. Thanks for folks in this room. I take a motion to adjourn.
I'll make a motion, we adjourn at this time.
Second.
We have a motion and a second to adjourn the Board of Health meeting. All in favor, please say aye.
Aye.
Aye, motion carries. It is 9:57. We are adjourned. Thank you.